Well, I think what I'm optimistic about is that one of the things is over the last few years we've done a tremendous amount of work to put the foundation systems in place. So now we're at a stage where family physicians, 70% of family physicians now have an EMR. So they're all gathering that data, so that adoption's going up. And then also we're beginning to see the kind of advent of putting these solutions into patients' hands with personal health records and so on across the country. So I think there's a great amount of investment that's gone in, and then when you combine that with the enthusiasm at the conference and the fact that people really are focused at making these useful tools in people's hands, I think that's a kind of pressure that's going to really push this technology out.
Well, I'm really excited because I think we're at a turning point in terms of health information in Canada. There's a couple things that are really critical developments, I think. First of all, we're at a point where we have large, good quality data sets covering many parts of the health system. So we actually have better data than we ever have before, and those data can be used to answer a lot of questions that are important for the health of Canadians. And the other thing is there's lots of interesting developments in analytics that will let us exploit those big data sets fully to the benefit of decision makers who are trying to help improve the health system.
I'm optimistic about health analytics because it's clear that people are now beginning to understand that we have to identify problems in the healthcare system, problems for patients, problems for the providers, that can be improved upon by understanding and using more data. There's a lot of data out there, and we're learning how to use it and how to use it in a way that actually overcomes the problems we have in healthcare right now. And that recognition that we need to do that by identifying problems that have to be overcome and analyzing the data and see how it can help us make better decisions is great reason for optimism. Yeah, what I've been hearing so far, I think, just reinforces, I think, that we are beginning to understand how we can do these things better. Years past, you developed the technology and then tried to find some application for it. So it was the proverbial, if I've invented a hammer, everything is a nail. Now we understand we need to identify the problems first and what we can do to overcome them. And that, I think that was the theme in one fashion or another from all the conversation. So what I'm taking away from that is sort of encouragement that more and more this is being seen as what is necessary to be effective.
I think the fiscal context going into the next 5 years represents probably the key enabler to demonstrate the purpose of data analytics, proper data analytics to support the types of decisions we need to make. And when we look at the issue of aging population, prevalence of chronic conditions, I think that really frames that purpose very well. When you factor in the issues again of aging, chronic conditions, and we've talked about ambulatory care sensitive cases, which we've termed as preventable hospitalizations, and which are of particular importance in the New Brunswick context. We're way over national average on these issues. When you consider this also from a context of continuity of service, I think it really represents a key opportunity to not only better identify these people, better understand their realities, but also to better serve them and ensuring that as they go through the health service journey, that we're getting to better outcomes.
I think what makes me most optimistic about the future is the alignment of the different constituencies that were in the room. We've got people who are deputy ministers or other senior officials from the provinces who are, thinking hard about what a new negotiation with the federal counterparts means. We had the federal government here. We had really reputable and thoughtful clinical leaders here from both Canada and the United States. And we had a really good representation of pan-Canadian organizations, all of whom rely on data and health analytics to realize their objectives and their agenda. And so perhaps more than any other time in the last 4 or 5 years, there's an agreement on the priority, and there's a narrowing of focus on what the priority areas and the focus of investment should be in the future.